The Senior Reset podcast delivers education and resources to help seniors and their families set themselves up for success. Each week, we dive deep with medical professionals and industry leaders to bring you answers to the questions that matter most. From the latest medical advice to financial strategies to staying ahead of scams, we'll build the toolkit you need to thrive. Here's your host, Joel Stewart.
Hey, everybody, and welcome to the Senior Reset podcast and events. We've got a great lineup today, a great guest. I'd like to introduce everyone to Bruce Muller. He is a S.H.I.P counselor. And for those of you that don't know what S.H.I.P is, you're about to find out, and they are going to be your best friend when it is time for you to get into Medicare. I also have my co-host, the wonderful Nicole Farmer. She is the director of Signal Health Group, Indiana. And we're going to flush this out. We're going to flush out Medicare, and we're going to flush out what it covers. We're going to flush out the supplement plans, and then we are going to talk about the Advantage plans that many of you may already be getting advertisements for, and we can talk about when it may make sense to choose one over the other. To kick us off, I would like to just throw out a little riddle. This is just something for you to kick around in your head during the meeting. A little bit to add some extra fun, because here at the Senior Reset podcast, we are talking about resources, education, solutions, entertainment, and training. So, and a little bit on the entertainment venue, we're going to throw a riddle out there. So here's the riddle. Compliments of riddles.com. The more you take, the more you leave behind. What am I? Very simple. The more you take, the more you leave behind. What am I? All right. And with that out there, we're going to get back to that at the end. I want to introduce Bruce. Bruce, why don't you introduce yourself a little bit? Introduce what S.H.I.P is, because everyone in the country has access to the very own S.H.I.P counselor that they can reach out to. And then talk to us a little bit about this thing called Medicare.
Okay, great. Again, my name is Bruce Muller, and I am a S.H.I.P counselor here in Indiana. And S.H.I.P is federally funded, and in the state of Indiana, we are sponsored by the Indiana Department of Insurance. Every state has a S.H.I.P program. For instance, when you sign up for Medicare at Social Security and you have questions about Medicare, they will send you to a S.H.I.P site. And again, we're all over the country. In Indiana, we have over 350 volunteers and some paid staff through different organizations. We are not insurance agents. We don't sell any insurance. We are pure help for Medicare. What do I do when I turn 65? What happens if I'm still working past 65? Do I have to sign up for Medicare? I've just signed up for Medicare. Now, what are my choices, and how do I make those different choices? And that's what we do. It can take an hour and a half just for the basics, because it's hard for some people to understand it because it is pretty confusing. One of the drawbacks is that we all try to make it maybe more confusing or nitpick at so many details, we just get confused. And that's what we try to do, is to simplify it so that it eventually makes sense. We won't tell you which way to take your options. We explain the differences to you, and it's still you to decide. You won't find a S.H.I.P counselor saying, well, in this case, or your case, this is what you should do. We don't do that. Many times people ask me, well, how do you take your Medicare? I won't tell you, because you would assume, because I work with S.H.I.P and I take my Medicare this certain way, that's the best way to do it. So it's not that you're out there on your own. It's just that we want you to have complete control of the situation so that you're happy with the decision that you made down the road. In terms of what Medicare is a program, a healthcare program for folks over 65, and also for folks under 65 who are on disability. So when you turn 65, you do have several decisions to make. and that depends on your situation. If you are taking some sort of funds from the government, such as Social Security, you will automatically be signed up. You'll get a card in the mail a couple of months before you turn 65. Now, there is the situation that you are over 65 or just turning 65, and you're still working and you have insurance through your employer. As long as that's a large group employer, 20 employees or more, you don't have to take your Medicare yet. So you can wait. And that's true if you are on your spouse's insurance plan or just your own plan. So by waiting, then you don't have to pay the Part B premium, which right now is $164.10. So you can wait. You will hear people say, well, you'll be penalized if you don't sign up right away. Not as long as you have what we call credible insurance, meaning equal to or better than Medicare, and you have a large employer. So if you want to work until you're 90 years old, you don't have to take your Medicare. Or if you want your spouse to work until he or she is 90 years old, you can stay on their plan. But then it does become a decision. Some plans are more expensive than if you went on Medicare, and some are much less expensive. So you do have to, weigh your options. So let's assume now that you are, turning 65, or you are already 65, you're 68, and you want to, take your Medicare. What are the parts to Medicare? First of all, you're going to have Part A, and that's your hospitalization. And you'll have Part B, which is basically your physician and some other services. And then Part C, that's the choice of an Advantage plan. And then Part D, which is your drug plan. So if you take what we call original Medicare, you sign up, you have your Part A. Then you have your Part B, and that's where you will pay a premium, which everybody pays, no matter how you take your Medicare, the premium on your Part B. And that's the portion that by staying on your employer, if it's available to you, that you don't have to pay. And then you'll have your Part D, which is the drug plan. So A is free, B is the premium. We pay 80%, and you have to pay 20%. And that's where a Medigap or supplement plan comes into play, because there's various deductibles and copays that you would face. But when you have the supplement, that takes care of all that. So you will end up with really no other expenses to your Medicare except for the Medigap policy, which starting out could be maybe $105, $10. And eventually you'll sign up for the drug plan. Now, one of the things to remember is once you sign up for your Medicare, the clock starts ticking on the Part B supplement plan, meaning that you have 6 months to sign up for that plan with no medical underwriting. When you first sign up for Medicare, you have 6 months to get that supplement, meaning they can't ask you any other questions except for your age, where do you live, your sex, and do you smoke. The smoking is the only thing that there would be a situation where you might have to pay more. But those other questions, that's all they can ask you. You could be in dire physical condition, really bad medical situation, and they can't rate you, meaning they can't charge you any more for that. And that is sold
I have a
by
question there.
Yeah.
So if you're older, like say you do work till you're 90, and then you sign up for Medicare, and then you get 6 months to do this, to get this supplement, will the price be higher for the supplement because you're 90 instead of say 65?
The price of a supplement does go up in time.
Okay.
So, for instance, let's say it started off at $110, $15 or something. By the time you're 90, you're probably going to be facing, depending, maybe a couple $100. But the difference is that when we compare original Medicare with an Advantage plan, when you have the supplement, You don't have to worry about any doctors being in your network. You don't have to worry about, where do I go for rehab? Who takes my plan? All of that sort of thing. So at that stage of the game, it's kind of a concierge service. And what I like to point out to people when they're making the decision, hopefully when we reach that age, if something is going wrong, it's usually not a situation, well, I think I need to go to the doctor and make an appointment for the next couple of weeks. It's usually urgent or an emergency. So in that situation, when you have original Medicare with a supplement, you just go to the doctor that takes Medicare, you go to a specialist, whatever the case is, with no worries. And that supplement plan will follow you no matter where you go. So if I'm here in Indiana, if I'm in Oklahoma and something goes wrong, I just go to a doctor or specialist that will take Medicare, and then that supplement will follow. So when you're first signing up, you're going to have, with original Medicare, which we call alphabet soup, A for the hospital, B for the physician, and other things such as durable medical equipment and some other things. And then you'll have your Part D, which is your drugs. Now the drugs, again, that's a separate policy that you'll have. And that will vary, of course, in price, because of the drugs you take. It's basically a discount from, the cost of the drugs. And the important thing is, again, if you don't take that on time, just like the Part B, there could be penalties. Some people try to sneak by without a drug plan because they're using GoodRx or something. Yeah, the GoodRx will work for some of your minor drugs, or maybe even some what we call tier 1, the lesser expensive, less complicated drugs. But for the heavy duty drugs, it's not going to be a savings. In fact, you'll probably have to pay more. So you don't want to put off, having a drug plan. So, you've signed up. So you've decided, I know I want original Medicare. And when you shop for the plan, there's several different plans that people like. Plan G being the most popular. When you sign up for that and you look at the different companies, you don't have to call each company or contact each company and say, what do you cover with your supplement? Those are all standardized. So what Aetna does or United Healthcare does, it's just a matter of choosing a plan, looking at their cost, and there's different ways to look at the cost of those plans. Some of them are attained age, whatever age you are at the time you look at it. Some are what we are called community rated, and that they are based on the pool of the community. And there's different philosophies about that. I think you can get really bogged down in a lot of that kind of information. And I think for the most part, in the end, down the road, they're all pretty well equal in price. So, you started, you're on original Medicare, A, B, you have your supplement and your drug plan. So you're all set. Now with that original Medicare, you can go anywhere in the country, and that will cover you. If you permanently move from Indiana to wherever, Florida, you do need to check with the drug company just to make sure that everything is okay in that particular area. So again, you can go to any doctor that takes Medicare, and that supplement will follow you. So it's really kind of, it's easy. There's really, no complications. I've never heard of a case where their supplement didn't follow them properly or do what it wanted to do. Now, the supplement will only cover Medicare, related services. So, they're not going to cover a facelift or whatever the case might be. But as long as it's something that, the doctor who is a Medicare doctor, prescribes whatever the situation is, that's going to follow you. So there's no worry. You go to the emergency room, you show them your cards, and you're all set to go. And again, the only thing is, yes, those will get pricier as time goes on. But again, it's, I want to say deluxe service. Many people will refer to Plan G. Another one is Plan N, which is generally for people who are pretty healthy and don't go to the doctor very much. They might have a little bit of a savings there because they'll have a copay when they go. But G is by far the most popular. And again, a lot of people call that, the Cadillac plan.
So Part G, is that in the drug plan you're talking about?
No, that's your supplement.
Okay. So these are different supplement ideas.
Yeah.
Gotcha.
Yeah.
Can
So
you
when you get a
switch
Plan
supplement
G,
plans?
that's the supplement. When you call up, United Healthcare and you tell them I need a supplement plan and I want Plan G. They know exactly what you're talking about, and they will show you the different costs and plans.
So if the supplements have different plans, some maybe are better for healthier people, some maybe for people who have more issues. Is that something that people can switch in between after they initially sign up for, or are they stuck with it?
Generally, no, you can. However, after that initial 6-month guaranteed period, now if you want to change, the company can underwrite you. And that's one thing that will, hopefully I don't confuse everybody, but we can talk about right now with an Advantage plan. Yes, there's original Medicare and there's an Advantage plan. You can switch down the road. However, if you're on an Advantage plan, you want to go back to original Medicare and it's 2 years down the road, now that company can underwrite you and look at your health and say, geez, Bruce, you had a heart attack and a stroke and, we don't want you, or here's the cost, which I would probably interpret as, I don't want you either. So, you have to face that. However, when you're on original Medicare and you want to go to an Advantage plan, you can go, well, during the open enrollment period, which is the appropriate time. So an Advantage plan will always take you. So, we always hear, yeah, you can go. Sometimes people take an Advantage plan and they think, well, if that doesn't work out and there's some problems with it, well, then I can go back to original Medicare. Well, in theory you can, but in practicality you can't, because again, you'll be underwritten. And that's one of the things we stress. I don't know about all of you folks, that I'm a great procrastinator. I'm a professional procrastinator. And people think, well, I'm going to turn 65 in January. I got plenty of time. Okay, I signed up. Yeah, I've got 6 months to sign up for that supplement. And before you know it, that 6 month is up. And maybe you have an health issue that's going to really prevent you from getting a plan. Now your only choice is an Advantage plan. So we always stress to people, keep your wits about you. Many people start calling us, a lot in advance, because it's as much a health decision as it is a financial decision too. So you just want to keep your wits about you and sign up, when it's appropriate.
So it sounds to me like with these supplement plans, and we're going to talk more about those Advantage plans in a little bit, but
yep.
On the supplement plans where they have different versions that you can get, that if you do choose one over another, that people should probably take a longer view. They might say I'm healthier right now, but if I'm going to have this thing for the next 30 years and I can't change it, they definitely should consider the fact that their health may not stay the way that it is when they initially sign up for the plan, because generally there's a lot more people alive at 65 than at 100. So something usually happens between those two ages.
Well, exactly. And we men are the worst about that. Well, I don't take any drugs right now.
Oh yeah, well, especially if you get automatically enrolled. I mean, I could easily see myself, oh, I'm getting automatically enrolled in Medicare. I'll just let that happen. And then you have 6 months that kicks in right away, it sounds like, right? So
right,
you don't even have to do anything and your clock starts.
Yeah, if you're taking like already on Social Security, that's going to kick in. And then you think, oh, I got my Medicare, I'm all set. When in fact, you haven't looked at it and seen that, wait a minute, I have Part A and I Part B, but I didn't get a Part D. I mean, there are people that say, oh, I didn't know I had to get a Part D. I thought that was all rolled into one.
And Bruce, just to clarify, when you're saying underwriting, you, just for anybody that maybe doesn't understand, I want to clarify for myself. You mean like prior to that 6-month window, they can't take into account any of your pre-existing conditions, but outside of that 6-month window, now they're going to rate you higher based on your health condition.
Yeah. I had a lady a couple of years ago that we called needing some help, and she had been just diagnosed with stage 4 lung cancer. She could do whatever she wanted because nobody could turn it down.
Right.
So that's why it's important, not to procrastinate, but to, get it under control. And I think most people are pretty good about getting it under control because, nobody wants to go without proper health insurance. I always compare it to my car and house insurance. I won't back my car out of the driveway unless all my insurance is properly in place. I mean, say, oh, I just got to drive around the block, I'll be okay.
Right.
So I think most people are really pretty good about getting a handle on it. In fact, not to get too far off track, but I just came back from working with a group of seniors who are all over 65. And we played our version of Medicare bingo, which is like playing bingo, but you have to answer the questions in order to win our little prizes. But that's how we go about and educate people. And before you know it, somebody's saying, wait a minute, I don't understand that. Well, do I have this or that? And, it generates all questions about, what kind of coverage they do have, because a lot of people don't know what coverage they have, because in a lot of cases, somebody has told them, hey, this is what you ought to do, and they do it. And if they have any problems, they think they're all set, So we are all set until we find out we didn't do things properly.
Right.
So, assuming somebody wants to go on original Medicare, again, they're going to have the different parts, and they get their supplement and their drugs. Now, that doesn't mean that they're done forever, because we still want them during open enrollment period. That's in the fall, October 15th to December 12th. That's when we want them to look at their drug plan, because somebody may have a lot of drugs. They're what we call a walking drugstore. They may be taking 25 drugs, and they haven't checked to see what the price is. I did have a case through one of our counselors where a lady was paying $33,000 out of pocket on the drugs. Came to us, we checked it out, found a plan that they were almost all covered except for, I think, around $1,000.
Wow.
So
wow.
Even though you're on original Medicare and you think you're all set, and you're griping about the cost of those drugs, but check them out every year. It doesn't cost you anything to check it out. That's why on Part D, we recommend, especially, the whole thing, we recommend you get an online account with, where'd I go here? I just lost you, darn it.
It's all right, we still see you.
Oh, do you still? Yeah, this was happening before, so I'm just going to continue. So, we do recommend that, you check your plans, in the fall to make sure that you're getting, everything that you should have. Again, like this lady, it happened to her, and the good news is she had the financial wherewithal to pay for it. The bad news is that she had the financial wherewithal and never, checked it out. So again, with original Medicare, you're going to have your various parts, and you're basically you're all set to go. Now, the alternative, and these are what you see advertised on TV, and a lot of people talk about, are what we call the Medicare Advantage plans.
Hey, Bruce, can I just cut you off there for 1 second? So just to kind of recap, traditional Medicare, it sounds like that if you are turning 65 and you're getting on Social Security, you're going to be enrolled automatically for Medicare. And when that enrollment happens, you have 6 months in order to choose a supplement plan from that enrollment, as well as to get on the Part D, the medications.
No,
And get into
you don't
that.
you don't have 6 months for Part D. You have to do that, right at this time you enroll.
Okay. And
The supplement's the only one that has the extended time period.
okay. And then for cost of Medicare, they're looking at Part A is free. Part B has $165 right now. It's currently, that may
Right.
change in the future, a month. And that is no matter what else you do, you have that fee for Part B.
Mhm.
And then above that, it's a cost sharing. It's 80-20. Medicare covers 80%, you cover 20%, unless you sign up for a supplement plan,
Right.
or this advantage plan that we're about to talk about. So if you so
Yeah,
that
but the
so that is
Advantage
kind
plan
of
will
that.
take care. Yeah, we'll talk about that in a second.
Yeah, and then the other cost is going to be drugs, which is basically cost. It's basically a discount plan for your drugs.
Exactly.
So somebody looking at the total cost of Medicare, maybe compared to their own current plan, they're looking at right now $165 plus whatever the supplement is, which if you get in the timeline shouldn't be too bad because it's just
Right.
about age and whether you smoke and stuff like that. And then whatever it is with the discount drug plan. So that's
Right.
kind of the recap of traditional Medicare.
Exactly.
And then from this point, why don't we launch into the Advantage plans and let you talk a little bit about that?
Okay. So an Advantage plan, you're still on Medicare. It's just another way of taking your benefits. So the basic difference is that Advantage plans operate with a network of physicians and other services, such as rehab facilities. So you do have to make sure that your physician is in their plan. And the plans are set up. There's either what we call an HMO, a health maintenance organization, or a PPO, which is preferred provider. Now, an HMO has a little bit smaller network of physicians. The major difference is that you'll have a primary physician, and if you need to go to a specialist, then you do have to get permission of the primary to go to a specialist. Whereas a PPO, preferred provider, you don't. You have your primary physician, and then you can go to a specialist if need be. Now there's no premium to most of those plans. Some of them might, but in general, most of them don't have a premium. So, again, you have to make sure that the physician, the hospital, well, almost all hospitals are in all the plans, and any other service that you use, you have to make sure they're in that plan. Now, in place of the 80-20, you will have what they call a maximum out-of-pocket expense. And that can be up to $8,900 a year, depending on the plan. The way that works is, let's say your plan with whatever insurance company has a maximum out-of-pocket of $4,000. Then once you reach that amount, not including your drugs, then everything is covered. So once you reach that 4,000 or 5, whatever the company is, some of them are higher than others, but the maximum allowed by, the law, the Medicare law, if you will, is $8,900. So once that's covered, then everything else is covered except for drugs. There are lots of times, again, if you're on HMO, that you do have to get permission or pre-authorization to go to another specialist, and maybe some other services too. You might have to have that. But in general, there's no premium, except for, of course, when we get to the drugs, a company might have 0 premium, or they might have, a premium. It just depends on the company. And again, even with an Advantage plan, it's basically a discount from the, the cost of the drugs. And again, people talk about using, one of the little coupon services that, oh yeah, I use that, and I'm fine. That's not always the case. Again, if something goes wrong and you need the heavy duty drugs, you certainly want to have coverage by some way, some form of Medicare.
Do these
but
Advantage
again, those are
plans,
built in.
do these Advantage plans replace Part D as well? Then they have their own schedule for drugs.
Yep. That will be your Part D will be built into your Advantage plan. So it's kind of an all-in-one. It's kind of a one-stop shop. With some, like I said, with some limitations. One of them being, if you go to wherever, Oklahoma, and you have an emergency, yes, you're covered for the emergency. But let's say you go someplace and you want to live for 6 months, but you have a situation where you need to go to the doctor periodically, then you need to find a doctor's in your plan, or you will have to pay the rate that is, out of plan. So that's a little bit different than original Medicare. Because again, with original Medicare, go to anybody.
That actually reminds me of a story of somebody that I know, whose mom was flying out to visit them for extended periods of time. And there was a point where she had to cut the visit short because she had to fly back because she had to see a specific doctor back in their hometown. It sounds like that. Like I didn't really put two and two together at that time, but it sounds like that's a Medicare Advantage issue where they had the HMO.
Yeah. Well, some of the companies now do have the ability, but I'm not sure which ones, are, that you can go to, say it's United Healthcare, you can go to a doctor in, Timbuktu that takes United Healthcare, but I'm not sure just how widespread that is. And where it kind of breaks down to, like, for instance, in my state, there's some areas where they're in between, they're, I'll say more rural, but, they're in between two major cities, and, where do they go? I go over, I go to this city for some things, and then this doctor, I go over here. And so, when you're in a metropolitan area, you can get to pretty well any doctor that you need. But when you live, just live in some other areas where it's harder to get doctors, then it becomes a problem, and where, there's a definite advantage to it, to an original Medicare.
Well,
but those plans, again, you have to be in the network, and then you're going to, in place of the 80/20, you're going to have a maximum out of pocket. You may have some co-pays on various, things. Most of them don't have a copay for a primary physician right now, but you'll have maybe a $45 copay for going to a specialist. And now those are the plans that will offer you some dental and vision and some hearing. But most of them offer all three on a varying scale. But again, the doctors have to be within that plan. And some of them, some of the companies, you call an 800 number and they'll tell you who's in the plan that day. And that's a decision too. When you get to be a certain age, like me, if you can't tell from my picture, I don't want to switch my dentist. So it doesn't mean anything to me whether my dentist is in or out. If he were in a plan that I chose, great. But if he isn't, so be it, because I don't want to change. I have an eye condition that if I changed eye doctors, I would face days of examination and explanation and trying to, get the lay of the land. So no matter what, I don't want to switch my eye doctor. So that decision enters into it. I mean, a good dentist is a good dentist, but a lot of people, like the one they've been going to, they've been following them for the past 70 years. So that's a decision you have to make. The other thing is, and let's say a plan says you have a $1,500 benefit. Well, that doesn't mean you're going to get a full $1,500. Say your dentist charges $300 a surface, but the plan might say whatever is, reasonable and I forget the term, reasonable and common, and I can't think of it right now.
Customary.
Yeah, thank you. They will that's what they're going to pay you. So they, that 300 surface might only get you $150. So that doesn't mean you're going to get $1,500 worth of service. You know what I'm saying? So, but that's there. And for a lot of people, it's good, get a couple cleanings a year and then some other benefits. Maybe on the eyes, you might get an eye exam or two a year. Go from there. Now, some of them will offer some other things too. You might see some trips to the doctor. You might see some other costs that, they might cover. And that's up to the individual plan. And so, you have to look at those. Generally, they'll give you a list of all these things that you can get other than vision, dental, and hearing. You get to choose 3 of them. But so it's, but then, then it's up to them to decide whether or not they're, going to give, some of these extras to you.
So
But
for
now I'm just going to say one thing while
Yeah,
at
go
the
ahead.
top of my head. So right now, so let's say you choose an Advantage plan, and 6 months from now, wow, I don't like this. It's not working for me. You have a year's trial right. So within that year period of time, you can go back to original Medicare.
Do you have to do that during open enrollment, or can
No.
you do that at any
No,
time?
that's if I sign up now for for an Advantage plan, I have a year from today to do that.
Oh, okay.
So that'll let you go back into the supplement without having to get underwritten again if it's within that year.
Exactly.
You have to be on the supplement first and then
No.
transfer over and transfer
No.
back, or no?
No.
Okay.
No, this is what they call a trial right. Now, and what you were asking about, do you have to do that in the fall? Fall is when you decide, well, I don't like the Advantage plan I'm on. I want to change to a different Advantage plan.
Okay.
Now you can change plans. And during that open enrollment, you can change 15 times. The last one at the, on the, 5 minutes to 12, that's the one you're going to have. Now, with an Advantage plan too, though, there is a special enrollment period. Let's say you signed up for one, during the fall open enrollment. And then January 1st, you discover that, oh my God, my doctor's not in my plan after all. You have one more shot to change that plan, but only one. So if anybody does that, you got to be really careful, because you only get to press the button on the computer one time. And once you make that change, you're stuck with that plan for the year. So, and again, during open.
Oh, sorry. One of the things that I wanted to add that I've seen with some of these plans is, I know what you're saying, they can go in and out of network for doctors as long as they're in their network. But when it comes to things like home care and durable medical equipment, someone comes in with Medicare and that's a pretty straightforward thing. We know what Medicare is going to do. We can go ahead and send out the wheelchair or whatever type of medical equipment. We can go ahead and get started in the home health episode. When we run into these Advantage plans, we're having to ask, we're having to send in clinicals, we're having to wait on prior authorization, which is delaying the care or delaying them getting what they need.
Yeah.
In some cases, instead of the 80-20, maybe they can go out of network, but now they've got a 60-40. So there's just some different things that tend to be a little shocking when I run into some of our clients or patients that have one of these Advantage plans. They don't seem to understand the full picture of it.
Well, everybody gets blinded by the no premium,
So are you saying, I heard you say that, are you saying that $165 that they pay when they're on Medicare, they don't pay that?
No, everybody pays that, but I'm talking about an additional premium.
They pay no additional premium no matter
most
which
cases,
plan they decide with? Okay.
Yeah, except for the drug plan. The drug plan, they're probably going to have a premium.
Interesting.
Yeah, so the supplement cost, which would start probably around, well, right now, probably around 100 to 110, maybe more in the future, that they don't have to pay.
Right.
So it sounds, so if they try to go from an Advantage plan back to regular Medicare, they have to get underwritten for the supplement. But if they're in an Advantage plan and they want to switch to a different Advantage plan, do they get underwritten when they do that switch?
No, they'll switch. All right. And then the other question I had was that was coming up is you were saying some of these Advantage plans cover, they cover, what was it? Vision and dental and hearing.
So with regular Medicare, does regular Medicare not cover vision, dental, and hearing at
No.
all?
No.
No.
So that's
No.
an out of
There was
pocket
talk
expense,
this year it was
or-
going to get some dental, but it didn't happen. But speaking of original Medicare and then Medicare in general, this year the vaccines have all become, for the most part, no charge. For instance, the big one that there is no charge is shingles. In the past, the shingle shot could cost a couple $100 times 2 shots. And when we're talking to somebody, we're always preaching, get the shingle shot, because that is one nasty illness.
Yeah.
And so it's important. So a lot of things like that have changed. Mammogram, more than a couple of years ago, mammograms and colonoscopy, those used to have a copay. And a lot of people said, I don't have enough money for the copay, or I don't want to pay a copay. So they did away with that. So on the first screening on both of those things, you don't have to have a copay anymore. So it becomes, it can make your head like, oh my gosh, what do I do? And I compare it to my kind of like my house insurance or even my car insurance. Let's say I carry a high deductible on my house because I think the chances of my house having a fire are slim, hopefully. But where I live, we're always going to have hail damage. So within your lifetime of living in Indiana and owning a home, you're going to have hail damage at some point. So even though I have a high deductible, I do have to realize at some point in time, if I have that need, I'm going to have to cough up some money. So that savings that I have, I may have to give back at some point in time. It's kind of a financial decision. Whereas, it'd be like having my car insurance and, I've got a plan that covers a blowout or an engine, blow up, with no deductibles or anything, because I pay, I have the plan, I'm set to go. So it's kind of similar to that situation.
So just relaying this back to the Advantage plan. The advantages of the Advantage plan, as it seems to me, is that the one, and is probably the one that's most pushed, is that you don't have to pay the supplement fee, which is somewhere between 110 or more, depending on how old you are.
Exactly.
And then you get some sort of benefit, depending on the plan, for the dental, vision, and hearing that you wouldn't get under Medicare. And that seems to be the main 2 advantages, is that you get some assistance with those things and you don't have to pay the other ones. Are there other advantages from the Advantage plan that I'm missing?
No, I would say that's pretty accurate.
And then
there's the perceived savings, with not having to pay for the supplement plan. You get these other you get those other things in there. But then, there are some trade-offs to it, as in, having to have pre-approval on a lot of different things, or a procedure being denied, and then you have to appeal it.
Yeah, that's what I was going to go into next, was the disadvantages of the Advantage plan. So it sounds like on the cost side, if you are, say, 65 and healthy, the Advantage plan may actually have some pretty significant advantages, in that you don't have to pay the deductible and the co-pays you do have to pay. There's a catastrophic cap on them, which the catastrophic cap is much higher than your deductible would likely be if you needed to use it. So the potential cost of the Advantage plan is much higher than the flat cost of the supplement for most people. But in the beginning, when you're 65, you're probably not going to be using close to that catastrophic cap.
Right.
And then you get that extra financial benefit of the hearing and all of that. But then on the downside, say you're older, say you are in the 70s going into 80s, most of us have loved ones that are in that range right now. Medical issues seem to become more severe and more expensive. It seems that the Advantage plan is likely in those later years to be more expensive. And then the other downside is the freedom that you were talking about, the freedom to use the specialists you want, go to the doctors that you want. If you like to travel, being able to travel and get seen and get patients or getting to see doctors wherever you are. So if you don't like to travel and you're kind of in your home area and you're in like a metropolitan area with a lot of service providers, maybe that's not a big deal. If you're in a more rural area, maybe they don't have the specialists you need in network, or if you like to travel, there could be some big drawbacks to using the Advantage plan. Is that?
Yeah,
I think
I think that's pretty good summation. Again, don't forget, an Advantage plan is what we refer to, as managed care. So they get to have a little bit more say in the management of your care.
because they're
And when we're
managing your
talking
care,
about
not
those, we're
you,
talking,
right?
oh, sorry, go ahead, Joel.
I was just saying, under the managed care, the insurance company that has the Advantage plan is managing your care, not you. Whereas under regular Medicare, you manage your own care. Basically,
Right.
that's
Right.
That's
right,
where
so
I was going to. Yeah.
Yeah. So, it's, that's, it's just, it's harder than, buying your house or car insurance. You got a few basic questions for your, house and car insurance, with my car insurance, well, it's old and it's not worth much, so I don't have to carry, a collision or whatever on it, because, if somebody runs into it, so be it, so it's a little different where, with a human body, no matter how old it is, you need to carry, the proper coverage. So it does become just a little bit more, complicated as to, making the decision.
Yeah, and the thing that makes the decision really important, and why it's so important people arm themselves with as much information as possible, is that you can start with Medicare and with the supplement plan, that is guaranteed. If you go to the Advantage plan, you have 1 year to change your mind. And after that, if you try to go back to regular Medicare because you need that freedom, or you want to travel, or the specialists you need aren't in your network, when you try to get that supplement plan, they are going to reevaluate you for every medical condition you have, and it's
Right.
likely going to be incredibly expensive to make that change.
Yeah.
Whereas if you can just lock it in and keep it early on, you can keep those costs down for the long run.
You're right. That's part of the, thought process. And one of the things that I always tell people to do, you really need to do your own homework and make up your own mind. Don't ask all your friends what what they do, how do they take their Medicare. Well, you could, but you got to realize that they've got an opinion and an experience. Your health situation might be different. Also, too, if you talk to a friend in California or wherever, and they love that whatever plan, that plan might not be available in Indiana or wherever you live. So the Advantage plans are all by county across the country. So just because your sister in wherever likes her Advantage plan wherever she lives, that doesn't mean that you can get that same plan wherever you live.
It's awesome. So I wanted to go into a couple of questions that we had. Did you have anything else that you wanted to add on this, or do you think we covered the basics pretty well? Or Nicole, do you have anything else that you wanted to add?
Oh no, I think Bruce covered the basics really well. I would just encourage people to ask enough questions when they're looking into these plans and verify their doctors and their places are in network themselves, and not necessarily just take an agent's word for it. I would just fully informed before you make a big decision like that would be my only thing.
I would say, a thought just occurred to me that it probably is really important that you do your own research, because the Advantage plans have big insurance companies behind them, and they can afford advertising, whereas Medicare, I don't think, probably does a lot of their own advertising. So if you're just doing searches and whatnot, your searches might be more geared towards the Advantage plans than the regular Medicare, because the companies that have those are for-profit companies that have financial incentives to enroll people in those. Yeah, go ahead.
Oh, I forgot what I was going to say about it. But yeah, and again, it's, you kind of have to make up your own mind. Now, one of the new things that Medicare has started is, you see these ads on TV where, I don't know, William Shatner, who's ever is advertising the plans. They have to, I think the rule is now it has to be a specific insurance company. Before, they were just pooling it all, and whatever insurance companies were part of the program, they'd get to call you. And the other thing is, if an insurance person is showing you a plan and they work just for, I don't know, Anthem, for lack of a better, they have to tell you that, I work for a sole company. There could be other, if not better, options from other companies. So, it's become a little bit more straightforward about how this all works.
And the thought occurs to me that a call that they should probably make regardless is to a SHIP counselor to talk about this stuff, so that they can get some good advice from an expert in the industry that doesn't have a financial incentive either way. So you said the SHIP counselors are all volunteers.
Yeah.
That's
except for certain organizations, area agencies on aging and things where they are, they have a paid staff, but the people who work for us, if you will, or a SHIP counselor, they are all volunteers. They've gone through extensive training to learn about Medicare. And, because my wife hears me talking to my volunteers on the phone, and she said, I don't know why somebody volunteers for this, because it's difficult. But
it's a calling.
For instance, the volunteer that saved that lady $30,000, she'll be a volunteer, so she can't do it anymore. In fact, many of our volunteers are in that boat. A couple of years ago, I had one that Johnny was turning, I think, 83 or 84, and he said, Bruce, I got to give this up. I'm just afraid I'm not, I might miss something that I, shouldn't miss. But people volunteer because they've been helped. They want to pass it on because they know what they've gone through. And what we're talking about tonight is really pretty simple situation. I know if you're new, it sounds complicated, but there's a lot more other issues that pop up that, you would think by now with Medicare, there'd be nothing new that is tough to answer, but it happens to try and figure out what their situation is. But it's a great service. I've taken phone calls before where somebody said, well, I talked to an agent and this is what he told me. Yep, you're correct. You're good to go. Yeah, all your information is correct. But the SHIP organization, people do call us with other, kind of get involved in some other things, but you'll never, find a SHIP agent say, geez, I'm sorry, we can't help you. Almost all of us will go, well, let's see if we can, find some help for you in this situation. And we'll do our best to try and help someone, no matter what the situation is.
And for those of you that don't know, SHIP stands for State Health Insurance Assistance Program. You should be able to Google that any area that you're in to find your local SHIP counselors.
Yeah. If you go to www.shiphelp.org, so whatever state you're seeing me in, if you go to that will help you find your local SHIP site. And now one of the things to be careful of, we like, if somebody's got the wherewithal to, do their own computer search and everything, we recommend doing that. And we can, we give you your initial information and then you can go on and, research more. But boy, we warn you, make sure you've gone to, if you want to go to Medicare, the Medicare site, go to medicare.gov. or the shipsite.org. I've had people didn't realize what they were doing, and you know how it is when you're searching something online. Well, they've seen this information that looks like unbiased information, but it's an insurance company, And before you know it, they've given them their, their Medicare number and their date of birth and everything. And now they're captured.
Right.
So,
right.
And so the information might not be what you're looking for, but worse than that, now they're captured, and they'll become your best friend on a daily basis.
So I think we covered most of the questions that I have, but there is one that I thought I might ask that was submitted. So if you can't afford to pay for that Medicare, the Medicare monthly fee, what happens? So if you can't afford the premiums, what can people do?
Well, if your income is in a certain bracket, then you can apply for what we call Medicare Savings Plan, MSP. And for instance, in Indiana, now this varies from state to state. So in Indiana, if somebody's making less than at the high $1,800 a month, or I'm looking here, or $2,200 a month, it depends. Then either with those amounts, they could get their, that $164 or whatever, they could get that paid for. And then that also ties in, that's a state program. And then that also ties into a federal program called S.H.I.P, and that will help provide a lot of relief for their drug costs.
And what about the supplement plan? Is there anything that helps with that if they're on the supplement?
No. So again,
okay.
that makes a situation where, well, geez, I have to go to an advantage plan because, I don't have the financial wherewithal to do a supplement.
Gotcha. All right. And then, the last thing I just wanted to ask you, because I know that you have some expertise in this area. Is there what types of scams should seniors look out for when it comes to Medicare and Medicaid? People trying to take advantage of them, especially when they're trying to enroll. There's a lot of personal information that gets passed around in enrollment, I'm sure. What should people look out for?
Yeah. And that's one of the disadvantages when you call a company. Very few of them will give you any information until you've given them your information. You'll get these phone calls. Medicare directly is never going to call you. So it is illegal for somebody to call you and say, I'm with Medicare. They have to identify, and also now those calls are being recorded. So that if an agent or whomever's called you has misled you, there is some relief that you can get. So, the main thing is, if you get a call and somebody says it talks about your Medicare, you really don't want to talk to somebody like that, because they're just dialing for dollars. And a lot of those calls, for a person that say, you or me, that we don't have a financial problem with that amount, they're looking for people who are eligible for that, or maybe already on Medicaid, and they're looking to sell them a policy or to change their policy. So Medicare is not, they're never going to call you. IRS is never going to call you. Unless you've maybe made arrangement for a callback. Social Security is never going to call you. So, you just don't want to be talking to anybody that, calls you out of the blue on the phone, no matter what. It's not safe. And you need to protect your Medicare card just as you would your Social Security card. My opinion is, when you're 80 years old or whatever, you don't even need to be carrying your Social Security card with you. I can't imagine where you're going to have a situation where, you need to pull out a Social Security card. But you need to protect that Medicare card, because that's the new Social Security card. On the black market, Medicare numbers are becoming as important as a charge card number or a Social Security number.
Is that because, bad actors can order medication using it?
Well, yeah, they can, use it to, file false claims, things like that. You don't want to all of a sudden go to the doctor because, you need a kidney transplant. And, that, oh, wait a minute, you had one 4 years ago. No, I didn't. I've never had it.
Oh my goodness.
So, yeah, so that's, what you have to do. But, for anybody in general, let's face it, after a certain age, don't answer, don't talk to them. Don't try and outwit them because they're professional scammers. They're way better than you or me in conning us. So you don't want to talk to them at all. Don't pick up that phone number that you don't know. Of course, even a lot more seniors are on a computer now. And, boy, it's awful tough not to see that email that talks about whatever savings you might get on doing something. So it's, harder and harder to decline, opening up an email that shouldn't be opened up.
All right. Well, I appreciate that. And thank you for your time. So just to get back to give the answer to our little riddle, the more steps you take, the more you leave behind. What am I? The answer is footsteps.
Oh,
The more you
nice.
take, the more you leave behind.
Love it.
So hopefully I got some brain juice.
I had no guess at all.
Yeah.
No, of course, I was thinking, well, wait a minute. Now, what could that be? That's pretty good.
I like it.
Yeah. All right. Well, thank you for joining us, Bruce. And I hope you have a great day. And thank you, everyone, for joining us online. I hope you have a great week and join us next time.
Great.
Thank you. Have a good day.
Okay. Bye-bye.
Bye-bye.
You've been listening to the Senior Reset podcast. If you found today's episode helpful, please consider sharing with the seniors in your life so they too can live stronger, healthier, and more connected lives. Find all our episodes or submit your questions at signalhg.com/podcast. This podcast is intended for informational use and not as a replacement for medical diagnosis or care. Always consult your doctor if you have a medical issue.